last week, we've learned 2 survivors of the mass shooting at Marjorie Stoneman Douglas High School in Florida and the father of a 6-year-old girl killed in the Sandy Hook school shooting died by suicide. Their deaths show the lasting impact of such traumas on survivors. Well, here in the studio with us this morning is Dr. Sheela Raja. She's a clinical psychologist and author, and she has ways to talk about and show us how to cope with feelings that can remain following such tragedies. Thanks so much for coming in to talk about this really important topic.
Thank you.
Survivor's guilt. Tell us more about that.
Well, survivor guilt is actually very normal when people have undergone something as horrific as a mass shooting. You look back and you think, wow, is there something that I could have done or said differently to prevent this? Is there something I shouldn't have done? Could I have saved more people? And even looking back and saying, how come I survived when other innocent people died? And those are really normal and very profound questions that people struggle with.
And if you're having those questions, you should seek help.
Absolutely, yeah.
Now, how do you recognize survivor's guilt in yourself or a loved one, and what should you do?
Right. I mean, it is normal to ask yourself these questions after something of this magnitude. The thing is, if it's interfering with your ability to function, so if you are feeling like, why did I live? Why do I deserve to live? Or I could have done something different, and it's interfering with your ability to go to work or go to school, to function, to form relationships, or even to have moments of joy and happiness in your life, then you should definitely seek help.
Now, in the aftermath of some of these tragedies, active shooter drills are commonplace, but you say they can really have a negative impact on people.
Well, I mean, if you've survived something traumatic and you're kind of looking and, the message of those drills are, if we just say and do some of the right things, we might be able to save lives, we might be able to get out of there. And, these things are horrific and they're unpredictable. It's really hard in that case to know what the right thing to do is. The right thing is whatever you do to survive. And, that's one of the things I think we need to think about as a culture is when we're trying to support survivors. This is a mental health problem in terms of, suicide risk, but it's a public health problem that we're dealing with in terms of gun violence. So we need mental health professionals, public health professionals, and lawmakers at the table to solve this problem. When I talk to survivors of gun violence prevention, the number one thing they say, we don't want any other family to have to live through what we're living through, what we live with. And when we want to help them, yes, we need to reach out, we need to love them, we need to support them, but we also need to do something as a community to stop this from happening again. We need primary prevention.
Very good advice, and healing advice as well. Thank you, Dr. Sheela Raja.
Thank you.
And Dr. Raja has written a resource guide for young people, the PTSD Survival Guide for Teens. We also want to remind you, if you or someone you know is struggling, help is there. You can call the National Suicide Prevention Lifeline at 1-800-273-8255. That's 1-800-273-TALK. It's free, confidential, and someone will always answer your call.